Always clean the top of the bottle of insulin with alcohol or a clean damp cloth. Cloudy insulins must always be mixed thoroughly before use. Clear insulins do not. Mix cloudy insulin thoroughly by rolling the bottle in your hands and rotate it from top to bottom 15 to 20 times. Be careful not to shake it. Turn it over and make sure there is no powder left on the bottom. Draw air into the syringe by pulling the plunger back to the number of units needed for your injection. When inserting the needle into the bottle, try to push the needle in as close as you can to the middle of the rubber stopper. Eject the air from the syringe into the bottle. When you turn the bottle upside down, make sure the needle is covered by insulin. This helps prevent an air bubble from getting into the syringe. An air bubble is not dangerous, but it takes up space and can cause you to measure the wrong dose. At your next diabetes care visit, show how you prepare your syringe to make sure you are preparing it properly. If you have special needs, such as visual or dexterity problems, your diabetes care team can introduce you to devices that make it easier to hold the syringe and bottle. Some people who inject insulin use an insulin pen. There are pens that use disposable cartridges, and there are disposable pens. At first glance, the insulin pen looks a lot like a writing pen, but it has a needle instead of a writing point, and an insulin cartridge rather than an ink cartridge. Though you can't mix different types of insulin and put them into an insulin pen, pens do come pre-mixed with different insulin combinations already in them, or in their insulin cartridge.
The insulin pen to me is freedom, because I can stick it in my purse, I can dial my right proper dosage, I can inject myself, and no one has to know what I'm doing. It's just the convenience of being able to have my medication with me at all times.
Keep in mind that there are several different pens to choose from. Work with your diabetes care team to find the pen that works best for you and learn how to use it. Here are some things to remember when preparing to inject with your insulin pen. Always make sure that your pen or cartridge contains the type of insulin that has been prescribed for you. Prime your pen before each injection to help ensure your proper dose. If you're using cloudy insulin, roll the pen between your hands and tip the pen end to end to mix at least 15 to 20 times. After you have wiped your injection site with an alcohol swab or clean damp cloth, let it air dry. Remember to ask your diabetes care team for other tips when using your insulin pen, and regularly review your injecting methods to ensure proper technique. Insulin should be injected into fatty tissue. The recommended injection areas are the abdomen, the backs of the arms, the tops or sides of the thigh, and the buttocks. Avoid areas of scar tissue, the area around your navel, or any bruises. With most insulins, where you inject on your body can make a difference in how fast the insulin will go to work. Generally, the abdomen works the fastest, then the backs of the arms, the top or outer thighs, and lastly the buttocks. Work with your diabetes care team to find the injection area that is best for you. Try to use the same area